Hey guys, Dr. Rich here from Optimal Spine and Joint Center, and today I'm going to go over a long-awaited video about disc problems. Now in Oman, I would say the disc problems are the most common complaint that I hear. Most of the time a patient has already had back pain and maybe gone to the medical doctors. The medical doctors in the country have prescribed them an MRI, whether it's the neck or the lower back, and then have been told that they have a disc issue. Now, sometimes that same doctor or hospital will tell that patient to do physical therapy, and other times they'll tell them to do surgery. Those patients who often need surgery end up looking for a second opinion, not because they don't trust a doctor, but generally because they want to know if that's truly what they need or can they get around that surgery. They come here, we meet with them, we speak with them, we see what their spine is doing, what their posture is doing, and then we give them our honest opinion as to whether or not we can actually help them with or without surgery. Now, sometimes we're right and sometimes unfortunately we are wrong, but it's always worth a try if the person has a condition that we think we can help with. So, what is a disc? Well, when we look at the spine, we have the bones of the spine, and in between the bones we have an extra cushion, or that cushion known as the disc. And it's a spacer, and it also moves as we move, and that's how it actually feeds itself. Now what can happen, unfortunately, as we age, the tissue can get a little damaged or not so strong. It can start to dry out and get what we call degeneration. And of course, we can also injure it directly. Say we are in the bathroom and we slip and we land on our butts, or we're playing football, which is very, very popular in this country, and we slip and land pretty hard on our butt. We can injure our discs. So there's many different ways you can actually injure those discs. The thing is that when people go to the doctors, they'll just tell them they have a disc. They don't generally explain what the disc is, where it really is, what's actually doing to their spine. And I think these are important points to understand. So you have to understand there's multiple stages of discs. And generally when we look at a disc, what we're looking at, and I'll do a bigger presentation in a minute on what it looks like, but we have an outside layer called the annulus, which is a fibrous material, similar to the cartilage inside your knee here, okay? And then on the inside of that disc is a liquid center known as the propulsus, okay? Now, what can happen is we injure ourselves, or just aging and sitting too long with incorrect weight bearing on those structures. That inside material can start to push on the outside material, and we'll get a little bit of a bump. And generally you'll hear that as a bulge disc, in this case disc degeneration with a bulge. What can then happen is that inside material, that liquid material, can really start to push through that outside material. It starts to get a crack, and then that outside material really starts to come out and push, and in this case, this is what it's showing here, it pushes into the actual nerve, okay? And we call that a prolapse disc, or like a severe protrusion. The next is what they call an extrusion. So that's what's showing in this bigger picture here. This disc has gone all the way through, it's cracked finally that outside layer that has ripped, and now that inside material is flowing out. Now this inside material is very inflammatory, so it creates a lot of pain. And this is somebody, if you know anybody who's had a disc, they bent over, they picked something up, they heard the pop, they got pain, and then they were incapacitated for multiple days, maybe even multiple weeks. Usually that's an extruded disc. The material in there is very inflammatory and creates a lot of pain. And then finally, sequestration. Now sequestration is the more worrisome one, because what happens is that same extrusion happens, but then that inside material starts to fragment off and starts to kind of hang out where these nerves are. And it can create permanent nerve problems, like loss of the sensation of the skin, or even strength problems in somebody's body, okay? So, on an MRI, we're generally looking at their discs, and this is what I was talking about when the medical doctors say, you have a disc. Well, what does that mean? Is it severe? And there's different severities of a disc. So in this MRI here, where it's circled is showing you where there's a disc. So let's go over a little bit more normal. Here's the bone, in between is the disc, and then here's the bone again. Okay? Now a healthy disc on an MRI will appear in, at least in this what we call T2 weighted series, will appear as white. And what that's generally showing us is that there's still fluid inside that disc. That fluid that's on the inside, that propulsus, hasn't come out yet. Okay, so as we go here, we're starting to see that degeneration. It's still a little white in there, so there's still a little bit of fluid, but you can see that disc has a little bit of a bulge past where it's supposed to go. But this is very, very minor. Okay, it's not a very severe disc, and in fact, this may not even be compressing any of the nerves or where the spinal cord is, or the nerves that come out. We're going to need different imaging to look for that, but again, this is very, very minor. We then come to the middle one here, and again, same level, an L4 disc, and you'll see this one's a little bit much more severe, right? And actually, you'll see that it pushes this is called the thecal sac, the sac that holds the spinal nerves and the spinal cord, okay? And it's really pressing into that. So of course this person is definitely getting some of that impingement. Now you also see it looks like a bubble. So again, that's showing that liquid has gone out and it's really just pushing into that outside layer there, and that ligament now is pushing back towards the spinal cord. And then of course finally, a very severe disc, and we'll see this big balloon. It comes almost all the way to the back of where the spine is, and again, that's going to generally create a lot of pain. You know, the interesting thing about discs is, though, I've seen people like this in excruciating pain, and I've seen people like this with very minimal pain. So again, sometimes even the severity of the disc doesn't necessarily mean the person is going to have pain or even neurological deficit, and that's a really important point to make, because if somebody doesn't have those nerve deficits, those are people that we probably want to try to treat without going for surgery first. Now, also, where does this fall when we look at the bigger scheme of the disc? And so that's what this next image is showing. This is other images that we'll now look at. And so this is like looking down on top of a disc. Like if we held the disc, we're looking down on top of it to see what it's doing. So here is an actual disc. And then here is the bones of the back, here is some ligament tissue of the back, and here is the spinal cord, and then these are where the nerves would come out here, okay? So in this case, we see this disc, the disc now comes down, presses in, and you can actually see it indents the spinal cord here, and so this person has like a centralized disc that's pressing on it. It slightly collapses on this side of the nerve. It's not really that bad on this side. And then this person also has a little bit of ligament problems down here, squeezing on the nerves, on the spinal cord as well. So again, generally this person will experience pain, maybe numbness, maybe tingling, but again, maybe they won't. So we need to then check. Here's another version of this. And so again, here is the disc, and then here's the bone, here is the spinal cord, and again, here's more severe, right? It comes down, it completely comes down into the cavity here. It completely compresses where that nerve once was, okay? So again, we have to look at multiple angles on an MRI to truly get an idea of what's going on there. And then we have to correlate those ideas with what's going on with the actual patient before we decide whether or not should this person go for surgery. Should they try rehabilitation, or should we mix in some medical intervention like drug therapy, corticosteroids, or plasma-rich platelets, or even stem cells, and then also apply therapy for the best bet that they don't actually go through surgery? Okay? Now I'm going to show you a little bit of what's going on with these discs and a little bit more of a video format. So again, let's look at the normal anatomy. Is that ring on the outside called the annulus. That's that fibrous cartilage, as I mentioned before, like the knee. This is the inside material known as the propulsus. That's that liquid. Here is your spinal cord. Here is the spinal nerves. And of course, here's the bone in the back. So what can happen? We can get, obviously, on the right, the left, or the center. Here, what a central discal bulge looks like. That material on the inside starts to move out towards the back. This is a ligament within the spine, by the way, called the posterior longitudinal ligament, and it starts to press into that ligament, and then that ligament and disc tissue begin to press into the spinal cord. And of course, red means bad, right? We're starting to get pain here. So this is a very centralized disc. Of course, is it always that clean? Usually not. This is just a video, right? So the same thing can happen on the right or left side. So let's take a look at the right side here. And the right side, that disc comes out, and then it comes right into the nerve like this and compresses that actual column. So this person, again, would be probably right-sided, numbness, tingling, burning, weakness, and again, severity of symptoms usually describes whether or not this person is a candidate for what we do with care. Now, one other thing I want to point out is something they call it a posterior lateral here, but generally this is showing what we call an annular tear. So an annular tear here, the disc has now ripped here. This liquid is now going to flow through the disc, okay, and it rips through and then comes out. So again, this is that extruded material. Now what can happen in severe cases is that extruded material can come out and now it's fragmented off and we have sequestration here. And again, these are usually surgical, even outside our realm, because we're not going to be able to get rid of that material with therapy, and it requires some sort of surgical intervention, at which point we will then talk about rehabilitation with this patient. Okay, guys? So as a therapy structure, what do you do for people? Well, you know, in our business here, we are always looking at the structure of the spine, okay? So we're always looking at whether or not we have a normal structure. Is the curve bearing on those joints correctly and putting the pressure where it's supposed to be on a disc? And that's really, really important, because generally you see the doctor, he says you have a disc, and he says go see a physio. The physios generally don't do anything about the curvature of the spine. So if you have a very flat spine and we start to do therapy on it and we never change that curve, no matter what we do, that weight's can come down and compress on that disc. So we generally want to try to change the curve in the spine. So some of the therapies that are done generally out of a physiotherapy office or a chiropractic office is what is known as traction or non-surgical spinal decompression. Some medical doctors absolutely hate this. Some of them are cool with trying it. The reality is that the idea here is that it pulls the spine apart. So the compressed disc that is there, it is then pulling that disc apart and is creating room and a negative pressure to try to suck some of that material back into the space. But again, if a person doesn't have a very good curve, that may be a bit of a problem, because when they stand back up, guess what happened? It comes back down. So what makes us very unique and different compared to the other physios and even chiropractors and pretty much anybody else on the market is that we're trying to achieve a normal shape to the spine. So we apply different traction, and what I mean by that is it's called 3-point bending traction. It's been shown in the literature to be very, very effective at restoring the natural curvature to the spine. In this particular machine, what it's doing is we apply a force, we crank that force into the spine and slowly stretch the curve back into somebody's back. We start this machine at 5 minutes, which is actually a minimal amount of time. If we take you out within that 5-minute period, it kind of collapses back down. It's like a rubber band. After 5 minutes, you start to stretch. Minimum time into this machine for traction is actually 10 minutes, maximum time being 20. At 20 minutes, we're not making much more stretch through the ligaments. Okay, so then basically we want to try to stretch that curve back into the spine. Now we come here, and I just want to bring this up one more time. This is our offer for October. So our October offer is 70% off. Today is Omani Women's Day, but this is actually for the entire month. And it's only for the ladies. They're going to get the free consultation, where the rest of the population is going to get 70% off of their consultation. So if you guys have any questions, you like what you're hearing, please click subscribe in YouTube. Please follow us on Facebook and Instagram. Leave comments. Tell us what you do not like. If I'm too long-winded or not, let us know. And if you want to get in contact with us, again, our number is 944-88580. That is 944-88580. Or go on www.OptimalSJ.com. You can look at our profiles there, you can look at our office there, and you can even book your appointment there without need to call us. If you guys have any questions, let me know. I'll talk to you soon.